find it in a way that works with legislators. He calls it toxic stress. And he talks about strong, frequent, and or prolonged activation of the body stress response system. He's trying to get legislators to give us more money by talking about the physiologic effects, and it's working, because I'm telling you, you can get more money now for maltreatment than you could 35 years ago when I started. But anyway, the other thing he says is in the absence of stable adult support. So his argument is that even children who are experiencing the stress of poverty and the stress of intimate partner violence and all that kind of stuff, if they got a mama, daddy, grandma, aunt, uncle, somebody, child care provider, teacher, who's saying, I'm going to help you through this. I'm stable, I'm consistent, I'm nurturing, I'm responsive, I'm the same as I was yesterday, caring about you, that these children don't have the same negative outcomes. So this is really important as we start to think about intervention and what schools can mean for children. All right, just another quick picture. This is right off Jack Shonkoff's website, where you see the top sort of neuron has lots of little nodules sticking out for all those synapses that are important for brain functioning, and you see the bottom one doesn't. The top one is a kid who's in a typical normal developmental milieu, and the bottom is a child who's experiencing toxic stress. Just my obligatory ACEs slide, only one, just one, but basically to say to you that this early experience of adverse events, toxic stress, trauma, maltreatment, whatever term you want to use, leads to disrupted neurodevelopment, which leads to a host of other things, which ends up leading to early death, right? So high-risk health behaviors, that kind of stuff, smoking, drinking, you all know the ACEs study, 4+ ACEs, and you're more likely to do everything bad. But you're also more likely to have all these physical health problems, which is why one of the reasons we have such interest in this work, because, when you think about ACEs being connected to heart disease, right, it makes people stand up and take notice. All right, so I'm going to talk a little bit about the sequelae of trauma exposure for little kids, and try not to go into too much detail, although, I could talk about this all day long, literally. And actually, I have talked about this in a day-long session, and Carlo gave me 45 minutes, but that's all right. So, first of all, we know if you think about little kids that you're more likely to have broader and long-term impacts, right? And some people suggest that it's cascading, kind of like the ACEs, that you set them up, they start having the problems, you elicit certain kinds of behavior from your teacher, they think you're bad, you start to feel even more bad, you start to act out even more, and it cascades over the life of you as a child. Right? We know for little kids that trauma is more likely to involve their caregiver, so we have to think about that, and clearly direct victimization we know is more deleterious for young children. The thing about little kids, and I remember one of my mentors, Sally Province, used to say this, that for little children, development is so intertwined, right? It's hard to separate academic functioning apart from physical health, apart from social emotional skill, right? So what you see is this kind of generalized impact of trauma across domains, which ends up leading to lots of bad things for little kids. So on the physical health side, one of the things that we know, again, a lot of these children, if you think about Fred Wilson, sort of think about the under 1s and think about the under 3 months, these kids very, very often are prenatally substance exposed, as well as living in a substance-using caregiving environment. The ones who are prenatally drug exposed, it's not the drug that seems to give them the bad outcomes, it's the birth outcomes that seems to give them bad outcomes, like prematurity and low birth weight. So it's not cocaine, it's not the opioids necessarily, it's what those systems do to the delivery process, but also what it does to kids' central nervous systems in terms of impaired neurodevelopment. It's not, they're not addicted to the drug necessarily, with the exception maybe of heroin. And of course, the drug that helps you with heroin, methadone, is just as bad. In fact, some people suggest it's worse than the heroin, but that's another story. Failure to thrive, little children who aren't growing well, shaken baby, which you all know is probably the biggest killer behavior of little kids, right? And when you ask parents why they shake their baby, you know what they say? It's the crying. It's the crying. So again, space for us to intervene and try to help parents to think about, okay, let me use my cognitive frontal lobe. What can I do when the baby cries? Even if it means I have to go out of my apartment and walk up and down the steps and leave the baby in the house, because that's better than picking the baby up and shaking them and leading to all those neurologic kinds of things. The other thing that's important to think about, you all know lots of injuries, lots of illnesses, but one of the things that Sarah Jaffe says in that paper I told you about is you see a very compromised immune system in these children. So they are not going to get over colds. They are going to have asthma eruptions all the time because their immune systems are compromised because of trauma, which is another thing that's amazing to me. So think about what that means for absenteeism in school, right? Everybody gets a cold. I've got a bunch of RAs who are collecting data from 500 preschoolers in the city of Baltimore. Christy and I are working on this study, 500. And I told them all the other day, get ready to get sick. Just get ready. They are little harbingers of disease. You know, they blow their nose, they wipe it on you, they cough in your face. Just get ready to be sick, right? They all get sick, they pass it along. But think about our children, the traumatized children who can't get over it. They're going to be out of school for a long time. So just things to think about. On the cognitive side, just to tell you what NSCAR tells us, 1 out of 2 children under 5 have developmental delays. As far as I'm concerned, that's an epidemic, 1 out of 2. Think about what that means, again, for children's readiness for school. Language delays, of course, executive function delays in some of the older children, school unreadiness, I call it, academic challenges, and some of the research suggests that the placement instability, again, what we're doing to help children to avert trauma, and I think we're doing the right thing, but we have to think about the fact that not only are we re-traumatizing them on a mental health side, but we're leading to even more cognitive and academic delays. Traumatic stress. You know, we think about PTSD and what happens when people come home from war, where there is clinical evidence that when you look at little kids, you see similar kinds of things. You know, the big 3 that they talk about in PTSD, re-experiencing the trauma. Any of you who've ever done child therapy, play therapy with preschoolers know what I mean, right? They come back and they relive the traumatic event over and over and over again. It's almost like if I play it out enough, it'll work itself through, you know, and it sometimes can get a little boring as a play therapist to do that, and you try to push the child to think about ways to resolve it, and they just want to replay the same event over and over again. That's the kind of re-experiencing that we see. Of course, night terrors and all those kind of things happen as well. You see numbing. Think about what the brain research tells us about that. You understand children just say, you know what, this world is too much for me, I am shutting down. So you see that kind of social withdrawal, but also restriction in play. Think about what that means for, you know, center time and things like that in Head Start, etc. And then probably the worst for them in the school environment, in the Head Start preschool environment, is the hyperarousal. So you know what these children look like. They're the ones who are scanning their environment all the time, you know, waiting for the other shoe to drop. So they see somebody over there playing with something, they're yelling across the room, I was playing with that, I was playing with that, right? But you also see them getting really dysregulated. So a kid walks by them and accidentally pushes them, and they start screaming and hollering, teacher, teacher, he hit me, he hit me. I mean, these kids who are just hyper vigilant, hyper aroused, that's the kind of thing that makes teachers start screaming at them and makes them want to get an ADHD referral and makes them want to get on medication, when really what we're seeing is the hyperarousal that happens to be around trauma. All right. We also see other kinds of things, right? The aggression and anger that really send teachers over the edge. I like to tell people about my colleague Walter Gilliam's work, and you all may have heard about it because it was all on NPR, et cetera, about the highest rate of expulsion being in pre-K. And part of that is because K to 12, you really have to do a lot of paperwork to get a kid expelled, right? You have to really work hard. But pre-K, it's easier, even if you're in the public school, but what he found was the private settings are the ones who are getting rid of these children. One bite, they're out. I mean, they'll even say that. One hit, they're out. So what you see is a lot of children who are being re-traumatized. Think about what that means. I get kicked out of preschool and then nobody else wants me. We had a kid who we had a conversation about who ended up in one of our studies who'd been kicked out of 4 different preschools. So what does that say to a child? And forget it if he's a foster child and he's having to move from foster home to foster home and has to change schools as well. But other things, new fears, loss of developmental milestones, and you know foster mothers really get mad at that if they've got a kid who's potty trained or toilet trained, and then you send them for a visit and the kid comes back home and he's sweating himself. You can hear a foster mother going, see, they had no business letting that child do that. Visits, I had him so he was potty trained, and look at all this. But you see, right, these children experience this as trauma, perception of threat, particularly if they've been with family members who've maltreated them, and you see regression in toileting, sleeping, etc. All right. The other thing that happens is, and this is so important for school-related issues, is they can't process information as well as other children. They have trouble organizing, they have trouble remembering, they have trouble attending. What do you need to do when you go to school? Organize, attend, all that kind of stuff. Their processing of social cues is off. So Ken Dodge does this work. Some of you might know about hostile attributional bias, where the child experiences a very normative event as hostile, right? Somebody brushes up against him, he's trying to hurt me, etc. Not being able to tell the difference between threat and non-threat, and also difficulty verbalizing, etc. Empathy. Big important issue. You all know if you can't take the perspective of others, can't feel what another felt, you are going to be somebody who's going to grow up and maybe shoot somebody in the face, right? Because you can't imagine what it must be like to be that other person. Lots of research about the importance of empathy for other kinds of relationships as well. I want to show you a couple of video clips actually, and I'm paying attention, making sure I don't have my yellow sign up. But this is a study that we just collected our 208th subject on, so we've stopped data collection and we're starting to look at what this means. But one of the things that we did was it was a buffering toxic stress grant. So we were trying to deliver interventions to buffer children against this kind of trauma, stress, etc. And so one of the things that we're looking at is how children respond to a mild stressor and what a parent does to help the child cope with that mild stressor. And what we're collecting, saliva, and we're coding and all that kind of stuff. And what we're hoping is that our intervention allows mothers to do this in a better way. But I just want to show you 2 video clips really quickly. One of a mother who figures it out and one of a mother who doesn't figure it out. But I'm going to warn you, the kids are very hyper aroused. So it's going to make you a little crazy. So.
Un poquito. ¡Qué cool! Mira, que be ready. Okay, ahora sí se sienta allá atrás. Okay, go. Asael. Hello.
one. And it's very painful to watch this. All right, and here's my...
Quedamos muy apretados. Ok. Sí, yo sé, está muy apretado. Ya va. Uy, perdón, Mateo. Ay, ya. Una más aquí. Ya, muy bien. Muy bien. Mira, gracias, sí. Te dejo uno ahí. Mientras tanto, y luego te quito. Empieza. Ok. Sí.
Mira, la señora tiene un caballo.
Aquí atrás, aquí. Ok, mandarina que acá. Mateo. Stop. Ok, ya vamos a dar vamos a necesitar que se... ¿No? Ok, puede interactuar con la cara. Sacarle de la silla.
Mira, se van a jugar. Está bien. A ver, ¿dónde está tu conchita? Tu conchita está aquí. A ver. Ay, no. Sí, ella tiene cosas chistosas ahí. No pasa nada.
Okay, I know you all are saying, what kind of thing did they do to those babies? But it was really a mild. As you can see, it was partly because they were confined, but the other thing, if you were a really good observer, that you probably figured out was that we were showing the children something, and we were showing them mass, and that's, the first child couldn't even pay attention to the mass. He got aroused as soon as we put him in there, and the second child, you could see. But the important part is what the caregiver does and how she's able to help the child modulate emotion. And you saw the second mommy just knew what to do. And by the way, neither of these moms had our interventions. I picked these because they were sort of extreme. But the second mommy knew how to help her kid. She knew what to say. You didn't have to speak Spanish to be able to understand. It was in her tone of voice. She went and got the blankie, etc., which is exactly what Jack Shonkoff is talking about. The capacity of parents or other caregivers, and I would argue caregivers in the context of early care and education as well, to know a child well enough, to have good enough strategies that they're able to help children who are experiencing this kind of hyperarousal to modulate themselves. So I just wanted to say a couple words about attachment, because this is an important thing for us to think about in the early years of life. First of all, you all know that there's a sensitive period for it, that it is about how a caregiver responds to you when you're under stress. That's what it is. It's not, the beautiful, wonderful things the gifts that somebody gives to a kid. It's the moment-to-moment interactions, the drudgery of feeding a kid, all that kind of stuff that makes a difference. And we know that it affects kids across domains. We know for maltreated children, right, that they're much more likely to fall in the disorganized category, right, if any of you know the attachment research, and we know that those have the worst outcomes. But again, thinking about it from Jack Shonkoff's perspective, if you can shift the parenting so that it is nurturing, sensitive, responsive, consistent, all those kinds of things, it can be a buffer against trauma. My argument is that just doesn't mean removing a kid and putting them in foster care. That means that there are things we can do with the birth parent. Tons of evidence-based interventions, as you all know, many of which have now been tried with child welfare populations, family checkups, safe care, promoting first relationships, healthy families, incredible years, nurse-family partnership. By the way, the McVie money, the home visiting money, is pushing these interventions to be even more careful about what they do and how they do it. PCIT, which is probably the only one that we have still that looks like it can reduce abuse in kids. ABC is the one out of University of Delaware, Mary Dozier. That's the one that we've been doing, parent-child psychotherapy, which is another one I love, swear by, nice outcomes. And Child First is another one that's been used that really is CPP plus case management. Also, I really like the ones that are now sort of looking at risk factors for parents, like depression, for example, that makes them more likely to maltreat their children, embedding depression interventions inside a home visiting, like Moving Beyond Depression. There's a great intervention for substance abusing moms in Connecticut that I really like, and in Missouri called CPAC. And then this whole issue of using parent coaching, not didactic parent education, which is what I used to do for the first half of my career. I'll never do that again. I will never have a parent group where I stand up and talk about, can you use timeout instead of whacking your kid? No evidence that it works. Evidence that mothers' knowledge about what's appropriate changes, but no evidence that it changes their behavior. There's a great paper by Rick Barth, I think it was in Social Work Education or something like that, that talks about the import of these coaching methods. Another thing I wanted to tell you all about really quickly is Safe Baby Court Teams, an initiative of 0 to 3, where they are changing how child welfare is dealt in the court. So they have these baby courts that are more infant-centered, that connect families to infant mental health, early care and education, early intervention programs. Like the one in Florida has a program that's attached to the court. Beautiful models across the country looking at that. I have 5 minutes, but I can do this. I'm going to show you all one more video clip, and this is actually of a mom post our intervention, a mom who's experienced a lot of trauma, immigration trauma, childhood trauma, trauma after she got to the States, just trauma, trauma, trauma. And I just want you to look at how she is engaging with her little kids. So, and it's to Whitney Houston. We pick the best moments that mothers have, and we give them this as a DVD at the end of the video.